Today we're with Terry Lemmon, head radiologist of Star Valley Medical Center. He's overseeing the radiology department, and we want to focus today on osteoporosis. Terry, thanks for joining us.
Sure.
It's a big part of people's lives and challenges out there, but there are ways to address it. Tell us about that.
So, osteoporosis is one of the diseases that affects the bones of the body. It makes the bones brittle and it makes them weak. So sometimes we'll see an elderly person walking down the street, we'll see that they're all hunched over. That's a sign of osteoporosis. As their bones get more brittle and more weak, they start to compress. And so that compression then accentuates the curves and causes those kind of spines that we see in people. It also causes the hips to be very, very weak. And so just a simple act that normally would be fine, like a ground level fall or even kneeling and twisting can break a hip. So osteoporosis is really a bad thing to have, and fortunately there are some treatments for it.
Now, generally, when they reach the point of coming to the medical center, they've been referred to by their physician. Is that the process as we move into the radiology stage?
Yes, so any patient can be screened for osteoporosis, but generally people who are really at higher risk are people who are over 65 years of age, people who perhaps have had abnormal kidney functions, maybe they've had to be on a steroid type medicine for long term for other problems. The steroids can kind of suck the calcium out of your bones. Women who are past childbearing age and who don't produce estrogen anymore, sometimes that can weaken the bones. So there's a number of clinical problems. Interestingly, women get osteoporosis about 8 times more frequently than men, but when men get it, it's just as bad as when the women get it. It's just as severe for them as it is. And there are a very small number of diseases where children actually have some bone loss or bone brittling diseases. So we've actually scanned a few children to see what the state of their bone strength is with this machine.
We're visiting with Terry Lemmon, head of radiology here at Star Valley Medical Center, going over osteoporosis is coming through this month where we recognize it. A comparison, Terry, to where we were and where we are now with treatment.
So it wasn't that many years ago that if a doctor thought that a person was at risk for osteoporosis, they would send them to a CAT scan machine, and we would do a scan of their hips and their lower back. And the CAT scan machine would do an analysis, and we'd run those numbers, and it would give them an idea of how strong those bones were. The problem is it had a variance of plus or minus 15%. That's a pretty big inaccuracy window. This machine, when we do a scan of the hips and spine on this machine, it's 0.1% variance. And so we have a very accurate measurement. So what this does is your bones can have that hard shell wrapper around the outside, and then the inside of your bones is actually very spongy, softer bone. And it's that softer bone is where osteoporosis affects it. And what it does is it sort of looks like a honeycomb. It looks like there's these cavitations. There's pieces that are missing. Instead of being a nice lattice work where everything's tied together, the bone actually cavitates and has missing bone there. That, of course, makes the bone much more brittle. And instead of being nice and spongy and almost pliable, it becomes rigid and hard and brittle.
New equipment to address it. A brief summary statement.
So osteoporosis is one of those things that tends to run in families, although anyone can get it. But if you have a grandparent, a parent, brothers, sisters that have problems with, if they had a fall and they broke a hip, if they start to have that stooped over appearance, those are all signs that the bones are probably experiencing some change, some weakening, some brittleness. And it's really recommended to go see your doctor. Talk to your doctor. He or she can determine if a Dexascan is right for you. They're very easy, 15 minutes, painless. The person comes in, we change them into a pair of cutoffs. They lay on the table. We take a series of 3 pictures. We're done in 10 minutes.
Very good. Terry Lemmon, head of radiology at Star Valley Medical Center. Dan Doxter for SVI Media.